Hi, I'm Rebecca Davis, the Medicare Wonder Woman, and today I'm going to show you what this lovely little card means. That's right, your Medicare card. Because the first thing you need to know about Medicare is what your card means to you. So let's break it down. With your Medicare card, you have two parts. You have Part A and you have Part B. Part A is what you've worked for all your life. You've paid in every day when you go to your job and then pull out your taxes. And if you've worked 10 years or 40 quarters, then you have paid for your Part A, and Part A does not cost you anything. Part A covers your hospitalization, your skilled nursing, 3 pints of blood, and hospice. But Part A does have some cost to it. Part A has a current deductible of $1,408. Now the thing about that is it's not a one and done deductible. You can actually get hit with that deductible multiple times a year. It's a benefit period. So it's about every 60 to 90 days you go in and out of the hospital. So if you were to go in the hospital, let's say on January 1st, and you got checked out on January 10th, and you went back into the hospital on March 15th, you would get hit with the $1,408 deductible again. Now, if you went back into the hospital on February 1st, it would be under the same deductible. So it does vary, but just know you can get hit with it multiple times a year. The other thing you need to know about Part A is if you have an extended stay in the hospital. If you're in the hospital 60 or more days, you actually start incurring a daily copay. Currently, that daily copay is $352 a day. Now, that's a copay, so that gets hit every day, $352 starting at day 60. And then if you're still in the hospital at day 90, that copay goes up to $704. That's right, $704 a day copay after day 90 until you've exhausted your lifetime days. After you've exhausted your lifetime hospital days, you are responsible for 100% of the hospital cost. That can really add up, guys. Now, the other thing you need to know about your Medicare card is Part B. Part B is for your doctor visits, your preventative care, your ambulance services, your durable medical equipment and supplies, things like that. Most people have to pay for Part B. The average price right now for Part B is $144. My writing's not the greatest today. $144.60 right now is the average rate for Part B premium. Now, if you have made substantial income in your life, especially in the last 2 years going into Medicare, that rate can be higher. So be careful about that. It's called IRMA. It's an adjusted rate according to your income. So if you made substantial income, you could actually pay more. But the standard rate is $144.60. And the other thing to know is if you're a low income earner, you could possibly qualify for extra help through the state, which could possibly pay for that $144 as well. So you might pay less or you might pay more, but the average is $144.60 is the standard on that. Now, Part B also has a deductible. It's $198 currently, but this is a one and done deductible. So you get hit with it one time a year only, and then you're done. But after you've paid the $198, then you're responsible for 20% of the bill. And that's 20% of the bill, whether it's $100 or 20% of the bill if it's $1 million, because there is no cap. So on traditional Medicare, you can be responsible for 20%, 20%, 20%, 20%. They can just keep billing you because they never cap it. You never have a stopping point. And to me, that's the scariest part about original Medicare by itself. You never know when that unexpected big event's going to happen, and you're going to be responsible for a giant chunk of 20%. That can really add up. So protect yourself by putting an additional plan to encompass all of this to help pay for these costs. Other things to know with traditional Medicare, This does not cover drugs, so there is no prescription drug coverage on here. So that is a separate plan that you do have to get. There's also no vision, no hearing, no dental. So that is separate as well. So keep that in mind when you're shopping your plans. You want something to help cover these charges. You also want to get something that covers prescription drugs, because there is a penalty if you don't pick up something now. You could incur a penalty later. And then if dental, vision, hearing is important to you, you'll want to pick up something with that as well. Hope this helps. Break down what this card means to you. If you have any questions, feel free to shout out. I'm the Medicare Wonder Woman. You can find me on Facebook, YouTube, or at my office at Cannonball Insurance Solutions. Our number is 254-918-5444. Y'all have a great day now.